Hello everyone, good morning, good afternoon, good evening, depending on your location. Welcome to my YouTube channel. Today we are going to look at epilepsy. Epilepsy is a brain disturbance that occurs when the normal activity of nerves are disturbed, leading to seizure. What is seizure? Seizure is a state of hyperpolarization of nerve impulses or hyperelectrical activity of nerve impulses that can lead to a temporal disturbance of the normal functioning of the brain. Right? And epilepsy can occur at any stage in life. Epilepsy occurs to newborn babies, and epilepsy occurs to adults and elderly above 60. Epilepsy occurs of two types. We have focused epilepsy, that is, it occurs at one part of the brain, and we have generalized epilepsy that occurs in every part of the brain. For the causes of epilepsy, there are various and many causes of epilepsy. One of the factors we have genetic factors. Epilepsy can be a genetic link from generation to generation. We can also have brain malformation from birth. Somebody can be born with a malformation in the brain that can cause epilepsy. We also have acquired brain injury, such as stroke or trauma. We also have abstinence to drug abuse, can also lead to epilepsy. We also have some conditions such as stress. We also have conditions such as lack of sleep. Lack of sleep can cause epilepsy. We also have conditions such as lack of, low level of sugar in blood. Low level of sugar in blood. This is because we need some amount of glucose in our blood. And glucose, we know that it helps in the normal functioning of our brain, right? It's an engine to our brain. So a low quantity of sugar in our brain can cause a low activity of our brain that can lead to seizure. Another factor, we have brain tumor. Brain tumor can cause epilepsy. We define tumor as abnormal growth of cells in the brain. So a low level tumor can cause epilepsy. We also have lack of oxygen in the brain. Lack of oxygen can be caused at birth. Lack of oxygen can occur during birth. Lack of oxygen can also occur during stroke. When we are having stroke, we lack oxygen in the brain, and this can lead to epilepsy. We also have brain infections like meningitis. Brain infections can lead to epilepsy. Symptoms of epilepsy depends on which part of the body is affected. Some of the symptoms we have for epilepsy, we have uncontrollable jerking and shaking of the body. We also have the body becoming stiff. We also have some strange sensations such as rising of the tummy, strange smell and taste. And one of the worst symptoms we have is collapsing. Many people suffering from epilepsy collapse. Consequence of having epilepsy leads to a problem in a relationship. You might be in a relationship in which the epilepsy you have disturbs your partner or your family, your relative. We also have a problem at work. It's obvious that people will have difficulties to manage your epileptic crisis all the time, or to bound to condition that can make you to avoid falling from epileptic reactions or from having seizures. We also have a problem, avoidance of driving. We always have this insecurity of falling or having seizures when driving. So these are the consequences of having epilepsy. It happens that we have two types of impulses. We have excitatory impulses and we have inhibitory impulses. So in the case of epilepsy, it happens that there is an imbalance between excitatory and inhibitory impulses. So during seizure, we have the entry of sodium ion at the presynaptic neuron. This entry of sodium ion causes depolarization. This now opens the calcium channel. The calcium channel that opens, which causes the influx of calcium ion into the presynaptic neurons. And this hyper-depolarization activates two neurotransmitters. We have glutamate and GABA. Glutamate has an excitatory effect on neurons, while GABA has an inhibitory effect on neurons. So glutamate being activated or being released upon the entry of sodium and calcium ions on the presynaptic neuron activates its two receptors, which is present at the postsynaptic neuron, that is AMPA, which allow the entry of sodium ions into the postsynaptic neuron, and we have NMDA, which allow the passage of the calcium ions from the presynaptic neuron to the postsynaptic neuron. After this high depolarization, we have another neurotransmitter, that is GABA, which has an inhibitory effect to cancel the effects of glutamate. Epilepsy be treated? Yes. In some conditions, Epilepsy is managed by reducing the frequency of seizure, and in some other conditions, epilepsy is treated. The options we have for the treatment of epilepsy, we have the use of medicines, that is anti-epileptic drugs, to treat or to calm the effect of epilepsy. The other option we have is surgery. Surgery goes to remove the part of the brain that causes seizure. Another option we have for the treatment of epilepsy is the insertion of an electrical device that can prevent the hyper-depolarization of neurons. And the last method I have for the treatment of epilepsy is adaptation of diet. Adaptation of diet. Diets for epileptic patients are called ketogenic diet. Ketogenic diet meaning high amount of fat and low amount of carbohydrate. For the methods to avoid epilepsy, we have first one, avoid head injury. It's not for no reason that head cask has been made when driving bicycles, and any other engine that can cause you have head trauma. We also have management of fever with the use of drugs or other method in children can help avoid febrile seizure. We also have other methods like avoiding infections. Infections such as meningitis in the brain can cause epilepsy. So by treating our environment, removing parasites, and educating the population on how to treat and remove parasites in the environment can help reduce epilepsy level. We also have the avoidance of stroke. Avoidance of stroke. We know that stroke is related to cardiovascular disease. So by avoiding diseases such as high blood pressure, such as diabetes, such as obesity, can help to manage or prevent the occurrence of epilepsy. Thank you for watching. If you learned something new today, write it in the comment box. I will watch it later. Please don't forget to like my video, subscribe, and press the notification bell for you to be alert of any new video I will post. Thank you for watching. Bye-bye.